through this map. I manipulated a bit with that, but in an overlap of 3 no-go zones, we had the most important needle and syringe program. Yeah, that's of course bad, and we know that. We know that from experience. We know it from the research. It was completely crazy, and when we tried to raise the issue, police was just no. We are not stressing people outside there, but they are, and this is the entrance to the needle syringe program. And outside we have this, it was called the Blue Bus. It's a mobile police unit where people could just get fined and punished right on the spot. So the death rate increased dramatically, and right to health not so much. We claim to have a universal healthcare system with free and equal access to healthcare for all, but these fine women are among my first clients back then, and they did not experience to have a free and equal access to our universal healthcare system. These are photos of not drug harms, but drug policy harms. These are harms from contaminated drugs. These photos are photos of politics before people. These are preventable harms. If it was possible to take photos of the level of stigma, exclusion, mental health, relations and connections, the economic situation, poverty, it would leave us with the same overwhelming sadness. And this is in a welfare state as the Danish. So it was quite clear that there was a desperate need for reforms. That was evident, and that was the Danish street lawyers' starting point. What we do is we handle about 1,400 cases a year. We win 7 out of 10 of the cases. It's about social law, health and medical law, upholding patients' rights, informed consent, safeguarding confidentiality, ensuring access to OST, pain management, withdrawal treatment, and so on, social benefits. It's about housing, family law, and some criminal law cases as well, because people still get punished for possession of drugs for personal use, though this still a criminal offense was decriminalized in 2007. People who use drugs should only be issued a warning, and also in repeated cases, but somehow either police don't know the law or they don't like it, I don't know, but we still see these cases. So, and we had some victories. We had needle syringe programs and OST for many years, not covering the whole country, and lots of it of quite poor and repressive quality. But we got the no-go zones abolished. We have seen different versions of treatment guarantees. So you are, from applying, you have the right to start treatment within 2 weeks. We also we managed to get heroin treatment started in Denmark in 2010, and it's been, I think you can imagine, to have just seen very good friends really suffering for so many years and just get so well in just a month in a heroin treatment program. That's just amazing. Yeah, so we got the heroin treatment, and we did it on the back of brave, pioneering Swiss, Dutch, and Canadian people, and Germany also contributed to this. Thank you for that, having the guts to pioneer and invent new ways, new forms of harm reduction. We also managed to get drug consumption rooms. It was not, we just had to insist on it from bottom up. And we couldn't wait for it anymore, so we just did it. We were a number of NGOs who just did it. And we managed, and the DCR law was passed in 2012, and in just 14 months, we had DCRs in the most important cities. And just a few remarks about, I just want to show you some pictures from the DCRs in Copenhagen, but we had them in the most important cities. And this was another thing we had. We had the no-go zones, now we had a free zone, a zone free of punishment. Police are expected to not stop and search in this area when they suspect possession of drugs for personal use. It's good, but we need to widen that area. So, if I can just put a few remarks on tips, tools, and tricks. It's about being a street lawyer who wants to see reform, drug policy reform. It's not just about being useful for users. You also have to be useful for anyone else, and that includes politicians, government officials, local governments, even police. Pay interest to their interests and motives and take it from there. Remember, you can come a long way if you do the work. It's hard, but do the work, but let others take the credit. And remember to praise them again and again. Politicians especially like that. Yeah. Mobilize, and assist users in mobilizing. Ensure meaningful participation in that way. And invite politicians. We've done that all over the years. And this is actually the current Prime Minister. It's a conservative government. He did street lawyering with us in January for almost 3 hours. And here he's listening to a guy who is criticizing the heroin treatment because it's not possible to create a meaningful life if you have to go there twice a day, 7 days a week, 365 days a month. You spend about 4 or 5 hours a day. We don't have take-home doses, we don't have anything. But that was an amazing evening, and we have election very soon, and probably not a conservative government for so long. She's our expected next Prime Minister, Social Democrat, and she's been working with us actually twice the last couple of months. It's a really, really good idea to drag people together, let decision makers meet people who use drugs, facilitate such meetings, because it's so hard to be nasty to people you know and even like. But still, there's so much to do, and all of this I just mentioned is just not enough. Please meet my friend Curly. He's not among us anymore. I miss him dearly, but he was an amazing activist, not least in the long fight for DCRs. Here he's on his deathbed. And 2 days before he was passing, he had stopped speaking. I found him in extreme pain. His face was distorted with pain, beads of sweat all over, and his nose were running. He couldn't swallow his methadone tablets anymore. So doctors just discontinued 400 milligrams daily of methadone. He was really, really suffering, and of course I made a scene, and fixed it. But this is happening in Denmark. Just want to tell you that. So people are still dying at a same high level. We have not seen an increase as in other countries, but not a decrease either. And what we do is actually too much to design for failure rather than success. We do it without adequately meaningful participation of people who use drugs. We do crazy things, and it's like we just discovered that in heroin treatment, women are forced to use contraception. And that's with no legal authority, of course. So it's clear to us, terrifying clear, that when you're criminalized for what you are, when you're criminalized for what you are, it's becomes somehow justified to violate people's rights, to outlaw them. Practice where people who use drugs are not protected by the law, somehow just develop. We must start listening and involving people who use drugs, listening to them. We must end criminalization. We must ensure safe drug supply and ending prohibition. Thank you.